Hello everyone, today I wanted to show you a somewhat complicated case of the knee. This is a sagittal view of a knee MRI. The patient is status post repair of his ACL. You can actually see the ACL orientation is a little bit vertical in this case, and you have to be aware of that because that can lead to impingement. But the finding I wanted to show you is that this patient has a very particular type of meniscal tear in his medial compartment. So let's move to the medial compartment. You see here we should have a nice bow tie, and we have absence of the posterior component of that bow tie. So we already know there's something happening with the posterior horn of the medial meniscus. Then we move to the anterior horn, and we see we have the normal anterior horn located here, but we also have this fragment there that shouldn't be there. And then we trace, and it has some connection to the root attachment, the posterior root attachment. So in this case, what I use is, and I have labeled my axial views here to help you guys identify it. So I use a lot of my axials, and what's happening, this might not project very well because it's a little bit too bright, but you can see that the normal medial meniscus extends all the way here anteriorly, and then we have another fracture, meniscal fragment here, and this meniscal fragment is anterior and medially flipped, and it's actually part of this body and posterior horn. So this is a type of bucket handle tear, if you want to call it that way, but it's really a flipped meniscal fragment, so it's almost like a figure of 8 in the sense that it's coming from this posterior horn and then being flipped anterior medially. So this is a flipped fragment here, and then I kind of drew some arrows to identify the fragment. Then you have the anterior horn, which you see there's some attenuation here, so there's probably some defect. Then you also see here the transverse meniscal ligament. So this is an example of a displaced medial fragment or medial meniscal fragment, and I wanted to show it to you because it's not entirely common, and it happens more often in young patients or younger patients. For the next video, we'll review a bucket handle tear, a more classic type of bucket handle tear. So that's it for today, guys. I hope you enjoyed, and please don't forget to subscribe.